80% of your immune system lives in your gut. Let that sink in. It's not your lymph nodes, not your bone marrow, it's your gut. So when the lining of your gut starts breaking down, when it becomes leaky, it's not just a digestive problem, it's an everything problem. Here's what frustrates me as a physician. Most doctors aren't even testing for it. They don't even believe it exists. Today, I'm going to explain exactly what leaky gut is, what causes it, and how to know if you have it, and why conventional medicine is 20 years behind all of this. I'm Dr. Myra Reed, a functional and internal medicine specialist. I have 35 plus years of experience, and I practice early detection longevity medicine. I help people find what others miss before the symptoms become a disease. Everything I do runs through my 4 pillars: hormones, gut, lifestyle, environment, helping you live smarter, stronger, longer. I always say, don't let your first symptom be your last. This is week 1 of my gut health series. Today is the foundations of what leaky gut is and why your doctor has probably never even mentioned it. So let's talk about what leaky gut is. Your gut lining is 1 cell layer thick. I say it's a tube like this, and one little bitty cell, that's the thing that separates what the food and everything that's going in your mouth and through your intestines of what you're eating. That 1 cell is what keeps it from your bloodstream versus the lining of the inside of your gut. So that 1 little cell is separating things like bacteria, toxins, viruses, or things that are going in your gut from getting into your bloodstream. These cells are held together by tight junctions. Think of it like the mortar between your tiles in your shower. If that mortar is there, it's keeping it, sealing the water out, and it's keeping things from going to the other side of that wall. But what happens if it starts cracking? Well, that water will start getting behind the wall, and that's when the damage starts. That's what we call leaky gut. Between the cells, the little gates break open, and the food and the toxins and things that you're putting into your gut can easily pass through those little gates and go into your bloodstream. Then what happens is it starts going through your body, having certain things like immune complexes that will go and set up shop in places around your body, which causes inflammation and other things to happen. So leaky gut is actually termed intestinal permeability problems. The seals between those cells will break open, and that's when the problem starts happening that I just mentioned. So when it starts getting into your bloodstream, then your immune system will start attacking it. It goes on high alert because those things are not supposed to be getting into your blood that way. So the body treats them like invaders, and that triggers those immune complexes that I was talking about that causes the inflammation in other parts of your body. It's not the kind that you see or feel right away. It's kind of a chronic, low-grade problem that drives almost every disease that I see in my practice. So let's talk about why maybe your doctor is not testing for it. If leaky gut is this common and it's this impractical, why isn't your doctor testing for it? Well, here's a few reasons. Reason 1, it wasn't taught. It's not taught in medical school. I went through medical school and residency, and leaky gut was never a term that was ever mentioned, not once. The concept of intestinal permeability exists in the research of several thousands of publications now, but it still hasn't made it to the standard clinical practice yet, even despite all this research. And reason 2, there's no drug for it. I say that not to be cynical, but because that's how medicine works right now. If there's no pharmaceutical solution, there's no incentive to diagnose it. No drug company is funding leaky gut awareness campaigns. And reason 3, the testing isn't standard. There are tests, you can do zonulin levels, lactulose mannitol challenge test, but that's not part of a routine blood work or routine testing. Your annual physical won't catch this. Your doctor would have to specifically order these tests, and most doctors don't even know this exists. So if you've gone to your doctor with bloating, fatigue, brain fog, joint pain, skin issues or rashes, and then they're told everything looks normal, Well, your labs are looking normal, but that's because they're not running the right labs. The 5 causes that I want to go through, what is actually causing the gut lining to break down. It's not just one thing. It's usually a combination, and that's what makes it tricky. Cause number 1, processed food and sugar. Highly processed foods creates inflammation in the gut lining. Sugar feeds the wrong bacteria. Even alcohol can contribute to this. And over time, this shifts your entire microbiome and weakens those tight junctions. Cause number 2, chronic stress. When your body is stuck in fight or flight, blood flow gets diverted away from your digestive system. Your gut literally stops healing itself because your body thinks it's in survival mode, and it's more important to bring blood flow to other parts of the body like the heart and the muscle than digestion. In the short term, that may be okay, but when its stress is never stopping all the time, your gut will pay the price for this chronic stress. Cause number 3, medications. Those NSAIDs like ibuprofen and naproxen, those are anti-inflammatory drugs and are one of the most common causes of leaky gut. Antibiotics wipe out your protective gut bacteria. Even long-term acid blockers can contribute to this, like those proton pump inhibitors. These are medications millions of people are taking every single day. Cause number 4, environmental toxins like pesticides, heavy metals, mold exposure from water-damaged buildings. These are direct irritants to the gut lining, and most people have no idea how much exposure they're getting. Cause number 5, infections and dysbiosis, an overgrowth of bad bacteria like yeast, like candida, even parasites. Even all these bacteria cause an imbalance of the gut bacteria and the gut lining, and they keep the gut from healing. Here's the important thing. It's almost never just one of these. It's usually an accumulation of things. Years of processed food, plus chronic stress, plus rounds of antibiotics, plus those environmental exposures and those medications. That's how the gut breaks down over time. If you're watching this and you're thinking, well, that's basically my whole life, you're not alone. So how do you know if you have leaky gut? Here are the signs that I look for. The obvious ones are digestive, bloating, gas, diarrhea, constipation, reflux, or alternating between some of these. You're having food sensitivities that keep multiplying. You used to be fine with dairy, but now you can't tolerate it. Even gluten, and then eggs. The list keeps going on. But here's what most people miss. Leaky gut doesn't just cause gut symptoms. It causes things especially like brain fog, fatigue that sleep just doesn't fix, joint pain without any injury, skin issues like acne, eczema, rosacea, autoimmune conditions, Hashimoto's, rheumatoid arthritis, lupus, mood issues like anxiety and depression. If you're dealing with 3 or more of these, there's a good chance that your gut is involved, even if your doctor says your labs are normal. There's something that I like to tell my patients, every one of them who walks through my door. I like to mention this. Don't let your first symptom be your last, because we can find the basis of things. So what can you do? There is hope. Here's the good news. The gut lining can heal. It's one of the fastest regenerative tissues in your entire body. The cells in your gut lining replace themselves about every 3 to 5 days. The problem was never that your gut can't heal. The problem is that most people never remove the things that keep damaging it. In my practice, I use a framework that's called the 5R approach. Remove, replace, reinoculate, repair, and rebalance. I'm going to do a full deep dive on each of these steps later in this series. So make sure that you subscribe because you don't want to miss these each weekly videos that I'll be making about the gut. But if you want to start right now today, here's the single most impactful thing that you can do. Start removing those biggest gut irritants from your diet for 30 days. The processed food, the refined sugar, the alcohol, and for most people, gluten and dairy, to name a few. Just 30 days and see how you feel. Your body will tell you everything you need to know. Next week, we're going to go into how your gut is triggering your autoimmune disease and why your doctor treating your autoimmune conditions may have never once looked at your gut. If this is resonating with you, I have a detailed video on exactly how to heal leaky gut, step by step. I'll link it right here in the description so you can go and look at that video as well. If you want to find out where your gut stands right now, take my free assessment. The link is in the description. And if you want to work with someone who actually looks at the full picture, someone like me that does functional and internal medicine, not just looking at your symptoms, there's a link in the description for that too. Everything I do, every protocol, every patient, every video runs through my one belief. I'm Dr. Myra Reed. I'm helping you to live smarter, stronger, longer, because I don't want your first symptom being your last.